Bonjour. Hello. My name is Jasmine Peterson, and I'm a psychological associate at Sullivan & Associates Clinical Psychology. Today, I will be presenting the next webinar in our series on Indigenous mental health topics, and our topic today is anxiety. I will be discussing with you how intergenerational trauma contributes to the experience of anxiety in Indigenous peoples and communities. Anxiety is our body's way of protecting us from danger. Some level of anxiety is healthy, helpful, and important. Too much anxiety, though, can be a problem. It is basically our body's alarm system. Some people have a very sensitive alarm system, while other systems respond appropriately. An easy way to understand this is to think of smoke alarms. Some smoke alarms are very sensitive. You burn your toast a little and they start screaming. The smoke alarm's job is to detect fire and alert you that there is a problem. But in this situation, there is no fire. It is ultra-sensitive and is misfiring, so to speak. This is how anxiety is for some people. Their internal alarm is too sensitive. It's alerting them to things that are not a real danger. Anxiety can be both biological and environmental. Anxiety is a high hereditary component. That means it tends to run in families. So, if your mom and your auntie and your siblings are all anxious, there's a good chance you will be too. If it is biological, that is, genetic, then there are specific ways in which the brain is affected. The limbic system is a collection of structures in the brain that have been found to be responsible for emotions in the brain. The hippocampus's size, which has always been one of my favorite brain structures for a number of reasons, one being that it is really fun to say, has been found to be related to stress sensitivity and resiliency in regard to mood and anxiety disorders. The amygdala, though, also fun to say, right, is like the superstar of anxiety when it comes to brain structures. This is one of the oldest parts of the human brain. It does a lot of things. It processes emotional stimuli and activates the appropriate behavioral response. In particular, it is responsible for expressing fear and aggression, and it plays a role in the formation and retrieval of emotional and fear-related memories. People with anxiety disorders might have more limbic system activity than those without. Neurotransmitters can be thought of as chemical messengers in the brain. Having too much or too little can affect a person's level of anxiety. Environmentally, sometimes anxiety is transmitted to children or family members through observation. For example, if children see their parents acting fearfully toward dogs, they might learn to be fearful of dogs. But also, if you are living in a stressogenic environment, that is, an environment that keeps your body responding to stress, like living in poverty, witnessing domestic violence regularly, or other frequent exposures to stress, your brain can become primed to be more responsive to even minor stressors, resulting in a greater experience of anxiety. Working in remote communities, I have sometimes observed that there are seemingly very high rates of anxiety in these communities, with many youth avoiding school because of how anxious they feel. Adults are sometimes struggling to socialize or even work because of their anxiety. Now, this is anecdotal evidence, so it could just be that because of the work I do, I tend to observe high rates of anxiety. However, it is difficult to understand how common anxiety really is in First Nations populations because there are tremendous gaps in research, with Indigenous people often being underrepresented. In 2012, the First Nations Information Governance Centre conducted the First Nations Regional Health Survey, which measured emotional distress among First Nations people in Canada, with a scale that had combined anxiety and depression symptoms. It found that significantly more First Nations were dealing with moderate to high psychological distress levels compared to the general population. This survey's limitation was that these numbers do not allow us to determine prevalence estimates of either depression or anxiety, specifically in First Nations communities. If you watched our last webinar on intergenerational trauma, you might recall that one of the ways intergenerational trauma is expressed is through anxiety. In part, this might explain the higher rates of anxiety that have been documented amongst Indigenous people. Trauma can increase our responsiveness to anxiety-provoking stimuli because of how it affects our structures and neurochemicals in the brain. So, people with a history of trauma can be more sensitive to danger, like that overactive smoke alarm, which can explain why people with a history of trauma might become more anxious. When we get anxious, we respond in one of three ways. We can attack, fight, we can run or avoid. That's the flight response. Or we can be immobilized by our fear, freeze. This is often referred to as the fight, flight, freeze response. When someone is anxious, a typical response is to fight. This can serve us well when there is a real danger. For example, if you've seen that viral video of the jogger's encounter with a mountain lion, his fight response to get loud and eventually throw a stone was reasonable and helpful. However, when we have anxiety in situations that are not actually dangerous, our fight response can become an issue. An example, if I get anxious while driving and yell at my husband, my fight response is not serving me well. The flight response is another automatic response of the brain meant to keep us alive. Again, it is useful in situations where danger exists. However, we often don't face the same situations that once made this automatic response useful. It can include avoiding certain situations, like social engagements, school, or work, or running from things that scare us. Lastly is the freeze response. This tends to happen when our brains are activated to a threat, but we cannot determine whether to fight or to run. Freeze can also be adaptive. If we are walking in the woods and a bear is approaching, freezing might be the thing that keeps us alive. These are all automatic responses that occur without thought. That is why it can be challenging to change these responses, even when they are frequently happening in situations we do not want them to be happening in, like fighting with a spouse all the time because we are experiencing feelings of anxiety. There are some things we can do, though, to moderate these responses. Breathing can be a very effective way to reduce our anxiety almost instantly. You can use many different deep breathing techniques, but generally, slowing down your breathing will slow down the autonomic responses in the body and allow you to stop and think more rationally. Mindfulness is a specific technique that requires us to be more present in the moment and can be very effective for managing anxiety symptoms. Because mindfulness requires us to observe our body, sensations, and surroundings, it can help us to learn to moderate our responses to the things we fear. Physical activity can reduce the levels of stress hormone in our body. If we have high levels of stress, it can make us more sensitive to anxieties. Of course, if we have high levels of anxiety that we feel we cannot manage on our own, finding a therapist to help learn strategies to manage your anxiety can help. The Non-Insured Health Benefits Program ensures that all Indigenous people with a status card can access therapeutic intervention as needed. Miigwech. Thank you for tuning in today, and I hope that this has given you some helpful knowledge and useful information. Look for more topics in our Indigenous Mental Health series.